Good evening, everyone. We are back with another case from gynecology. This is the fourth case. Today's case is about a disorder commonly found in women. Its prevalence is about 10% and it is often undiagnosed in women. It is a case study on endometriosis. Our patient is a 29-year-old female who had complaints of lower abdominal pain for 4 years occurring with her periods, pain between periods for last 18 months, and deep dyspareunia. Her pain is dull and constant across the lower abdomen. Medical history: no significant medical history is found. Patient has never been pregnant in the past. Medication history: she takes paracetamol and ibuprofen and goes to bed with a hot water bottle for up to 2 days every month. The patient has dysmenorrhea, which is painful periods. So she has to take paracetamol and ibuprofen to cope up with the pain. And her menstruation history involves she has regular periods and no menorrhagia is found. Intermenstrual and postcoital bleeding is also not found. Patient does not use any sort of contraception and is keen to start a family. She has never been pregnant in the past. Objective data: there is generalized lower abdominal tenderness, particularly in the suprapubic area, but no masses are palpable. Speculum examination is unremarkable. On bimanual palpation, the uterus is axial and fixed with cervical excitation. The pouch of Douglas is very tender and contains a mass. The adnexae are both tender, but no adnexal masses are palpable. The pouch of Douglas is an extension of peritoneum into the space between posterior wall of uterus and rectum in females. And the adnexae are the ovaries, fallopian tubes, and ligaments that secure the female reproductive organs. So it was tender, and there was a mass present in the pouch of Douglas. Specialized diagnostic tests, transvaginal ultrasound, and laparoscopy was found. There were chocolate cysts found in the laparoscopy. Chocolate cysts are the cysts which are filled with menstrual blood, which is usually found in endometriosis. Assessment: the diagnosis: the history of dysmenorrhea and dyspareunia are classic for endometriosis, and the ultrasound examination and laparoscopy images show bilateral endometriomas, also known as chocolate cysts, a complication of this disease. Signs and symptoms of endometriosis involves pain during periods, sexual intercourse, bowel movements and or urination, chronic pelvic pain, abdominal bloating, nausea, fatigue. Sometimes depression, anxiety, and infertility is observed. Need of therapy: to provide symptomatic relief and to treat infertility. About the disease: endometriosis is a common condition where active endometrial glands and stroma are located outside the endometrial cavity. Endometriomas develop as ectopic endometrial tissue on the ovary, produces blood, which builds up into an encapsulated cyst with each consecutive menstrual cycle. Endometriosis is benign but carries a high physical and psychological morbidity due to the clinical features: pelvic pain, dysmenorrhea, dyspareunia, and infertility. Examination findings include tenderness or a pelvic mass and may include palpable nodules in the rectovaginal septum and a fixed retroverted uterus secondary to adhesions. Diagnosis is made at laparoscopy, although ultrasound features such as these ovarian cysts containing ground glass echoes can be suggestive. Management and intervention: the mainstay of management for endometriosis is surgical, with ablation or excision of endometriotic deposits by laparoscopy. In this case, there are bilateral endometriotic cysts that need to be removed laparoscopically by incision and drainage with excision of the cyst capsules. Surgical treatment should relieve the dyspareunia and dysmenorrhea and may improve fertility in more severe disease. Medical suppression of endometriosis is possible with the contraceptive pill or gonadotropin releasing hormone analogs, which inhibit ovulation and hence stimulation of endometrial deposits by estrogen. However, these are ineffective for endometriomas. The levonorgestrel releasing intrauterine device has also been used to suppress endometriosis and reduce symptoms. To treat the fertility in the patient, combination of surgery, superovulation with intrauterine insemination, and assisted reproductive technology could be performed. Thank you.